So, Doctor, shall we start then? Can you unmute yourself, Doctor? Hello,
So let
Doctor.
me share. I'm still having problem with the sharing. Only the host can share.
Yeah, you'll be changed to host now. One second.
Oh,
Are we audible? Can anyone from the participants just type it in the Q&A or maybe in the chat box whether we are audible? Can anyone just type in the chat box? Participants, anyone? Yeah, okay. Dr. Monvosan has, yes. Alimon also has told that we are audible. Okay, fine. Yeah, okay. Great. So I think we'll start. So, so shall we start? Yeah, we'll start. I think number of participants has increased, and let other people can join afterward also. So, good evening, good afternoon, and good morning to everyone joining us from different parts of the world. So, on behalf of Ashish Life Science Private Limited, it is my great pleasure to warmly welcome all the veterinarians, animal health professionals, students, and companion animal enthusiasts who have joined us today for this international webinar. And the title of the webinar is Care for Your Companion Animals, Prevention and Management of Common Issues. So, my name is Dr. Abhijit S, and I'm an veterinary microbiologist and working as management trainee in international business and business development at Ashish Life Science Private Limited. So I'll be a moderator for today's session. And it is truly an honor for me to be hosting such an insightful discussion with distinguished speaker and participants from across the globe. So, at Ashish Life Science, we strongly believe that knowledge sharing is one of the most powerful tools to advance veterinary medicine and improve animal welfare. So, companion animals today are not just pets, they are valued members of our families. Ensuring their health and well being requires continuous learning, awareness, and collaboration among veterinary professionals worldwide. So, in today's webinar, this has been designed to focus on prevention, early diagnosis, effective treatment strategies, and practical clinical approaches for managing common health issues affecting our companion animals, particularly dogs and cats. So, before we begin, I would also like to inform all the participants that everyone attending this webinar will receive a complimentary e-certificate of participation. And additionally, to make this session even more exciting, we'll also be announcing three lucky winners at the end of the webinar. So everybody, please stay with us until the end of both the knowledge and for the surprises. So people who has completely attended the webinar only will be eligible for the lucky draw. So you'll be getting surprise gifts also after the lucky draw. So coming to the introduction of the key speaker, it is also now my great privilege to introduce our esteemed key speaker for today's session, Dr. Tommy Asinka. So Dr. Asinga has had an extraordinary journey that reflects both international experience and deep dedication to veterinary medicine. He was born in Suriname and later pursued his higher education in the United States, where he completed his Bachelor of Science in Biology and Chemistry from Eastern Michigan University in 1994. A strong academic foundation led him to pursue veterinary medicine at one of the most prestigious veterinary institutions in the United States. Sorry. He obtained his Doctor of Veterinary Medicine's DVM degree from Tuskegee University School of Veterinary Medicine in 1998, an institution globally respected for producing highly skilled veterinary professionals. Following his graduation, Dr. Asinga gained valuable professional experience in veterinary practice in the United States from 1998 to 2014, where he developed strong expertise in clinical veterinary medicine, particularly in surgical practice, which continues to be one of his major professional passions. Beyond his veterinary career, Dr. Asinga also has a remarkable background in athletics. He has represented Suriname in three Olympic Games in 1988, 1992, and 1996, demonstrating the same dedication and discipline that later shaped his professional career in veterinary medicine. An interesting and inspiring part of this journey is how life brought together both professional and personal milestones. Shortly before the 1996 Olympic Games in Atlanta, Georgia, Dr. Asinga met his future wife, who herself is a two-time Olympian representing Zambia in the 1992 and 1996 Olympics Games. After completing his veterinary education, Dr. Asinga and his wife relocated to Zambia, where they established Loving Hand Veterinary Clinic in Lusaka. Since its founding in 1998, the clinic has grown into a respected veterinary practice dedicating to providing high quality medical care for companion animals. And Dr. Asinga has been in continuous private veterinary practice since his graduation, serving the community with great dedication and compassion. His professional interests particularly include veterinary surgery, and he has also contributed to veterinary knowledge by authoring some articles like oral hematomas, which is a common condition frequently encountered in small animal practice. With decades of international experience, clinical expertise, and deep commitment to companion animal welfare, Dr. Azinga brings a wealth of knowledge and practical insights that will be extremely valuable for all of us attending today's webinar. So it is truly an honor to have such an accomplished veterinarian and global professional with us today. So without further delay, I would like to warmly welcome and invite our key speaker, Dr. Tommy Asinga, to deliver his presentation. So welcome, Doctor.
Well, thank you very much. I'm very honored to actually be part of this webinar and, of course, being the host. I take this very, very seriously. And in no way I'm trying to be like the all-knowing veterinarian. I'm learning every day I'm learning every day. I'm so sorry. Yes, I'm learning every day. Every day that I come to practice, I learn something new. So without further ado, we're gonna go ahead and start our webinar. And like Mr. Abjedit was saying today, we're gonna talk about care for your companion animals, prevention and management of common issues. Actually, just like we were just talking about, having a pet, you got to be ready to provide them with what we call a comprehensive care, right? Because it's not just having a pet and that is it. You have to make sure that you keep it in a safe place. Make sure you do the basic care for the pet. You feed them the right nutrition and management of often preventable health and behavioral issues. In order to be able to do all those things, it's very important that you take your pet for regular vet checkups. You feed them, like I said, proper food, do parasite control, and definitely mental stimulation, like walking the dog, play with the dog, teach the dog. If you do all these things together, you will ensure a long and healthy life for your pet. Maintaining a safe environment entail that you, of course, make sure you have your pet on your good pet ID. You do hazard proofing and safety. When it comes to the ID, it's just all about having a collar on your pet. If in case the pet run out of the yard or the pet somehow go missing, maybe you take him out on a walk and the dog runs off. Hazard proofing is a matter of checking the plants that you have around. Some pets like to eat on on plants. So you need to make sure that whatever plant you have, if it's something that you is toxic for pets, you make sure that you keep them separate where the pet cannot get it, especially puppies. Household chemicals, that is normal. I'm sure all of you understand that. And of course, small objects. Again, puppies are more subject to to these things because older dogs, once they reach a certain age, they don't like to just chew on anything. But puppies is a problem. As far as safety, you want to protect your pet. Make sure you keep him in um what I would say on in a fence yard, so the pet cannot just dig out or run out or jump over and go out. When it comes to extreme weather, you want to make sure that the pet is in proper shade, especially if this is hot. The water is also again part of safety because what happens is many times, especially in the hot environment, even the cold environment, sometimes you put water out in the morning and think, oh yeah, I put water for the pet before I left, and on before I left, and therefore the pet should have water all day. But in the meantime, the water was put in the hot sun, middle of the yard or wherever. Make sure that if that is the case where there's no shade where the water can be kept cool, that in I would say maybe in an hour, couple of hours or so, even let's say midday, you go and change the water and keep the pet in a warm place if it's cold weather. The other thing is you want to do veterinary checkups, like I mentioned. Schedule annual, biannual exams for the pet. If it's a puppy, of course, it's going to be monthly. Your vet will keep you up to date. And also, as veterinarians, I don't know if there are any that are checked in. Always make sure that when the pet come to us, for one, we explain to them what I just talked about, the safe environment. We talk about the nutrition, but make sure that the owner know when the next checkup is and schedule it with the client so the client is clear that just because they got the first set of puppy vaccine doesn't mean that they don't need to come back, because many times I've seen it many times where clients think that, oh, here is your puppy. He got the vaccine and he's up to date. Yeah, he's up to date up to a month. He's up to date up to a year. He's up to date up to 6 months. Whatever it is that the if it's vaccine, whatever it is that is recommended, you do that. If it's just a wellness exam, of course, if it's a younger pet, you tend to kind of wait a little bit longer, maybe once a year. If it's an older pet, you want to do that at least twice a year, just for them to check up, because those guys, they are things that can happen to them that sometimes if you check them a little bit more frequent, you're able to discover those things and be able to preempt any kind of problem. As far as vaccine, we've talked about that specifically. You know, of course, here in Zambia, rabies is a big deal, and pretty much all over the world, except certain countries. I know places like Australia, they don't have rabies, so it's probably not a big deal. But they really, really protect the country from introducing rabies there because of such a such a deadly disease. So make sure that when the client come, you if you do give the rabies, you need to let them know when the next booster is due. You give them that, and also any of you here, if you guys are like a client and you brought your pet in for the vaccination, make sure that you understand what the vet is telling you, that when the next thing is due, and make sure you keep that. If you need to put it on a calendar or something, then you get that done. Nutrition, probably of all the things we talked about, a lot of one of the things that's really overlooked. People will come get their dog vaccinated. They'll come, they'll put microchip on the dog. They'll come, they'll keep the dog on a leash every time they walk. But then when it comes to nutrition, many times people skip on that. They think, okay, whatever I eat, whatever is left over, that's what we give to the dog. So we need to make sure that we are talking to your client about nutrition, because it's such a integral part of health. Because the healthier, the better the nutrition, the healthier the pet, the less likely it is that the pet will have diseases. As a matter of fact, a pet that has a disease, if they still eating and drinking, they're more likely to get better than a dog that is have the same disease and refuse to eat, or if it's eating and it's not getting the best nutrition. So this is probably very, very important. Not probably, it is very, very important, but probably one of the most important topic that we can talk about. Anyway, one of the thing is, I know there are people out there, especially here in Zambia, we have a lot of clients. I would say most of our clients, they still think that they can't cook for their pet, feed their pet, and that should be okay. But many times there's a lot of stuff I'm missing. Many times it's possible that they do get the proteins right, maybe the carbohydrate right, maybe the fat content right, but then the micronutrients are the things usually where things are just going bad, in the sense that as far as management of the nutrition, so something like a NutriPower paste would be like a great thing to have to add maybe to the food. But look, sometimes if you have a very good dog food already, many times you don't necessarily need any something like this. But this is a very good thing to have, even if you want to do it like as a supplement, especially if the pet is not feeling well and you doesn't want to eat, then you can always have something like this at hand to kind of give to the pet. This right here is called liquid paraffin. Usually we see it mostly, it's mostly used for cats, and it's help with enough hairball, because those cats like to groom themselves a lot. Again, it's not really part of nutrition, but it's a good thing to have because sometimes they do get blockage, and something like this would be good to help, especially if your cat is vomiting. This is also another thing to help. And again, we talk about, to, if your pet has urinary problem, you can go ahead. Now, parasite prevention. This is probably after nutrition. This is the probably the next big thing, because if your pet has,
Doc, sorry to interrupt. I
uh,
just want to say one thing. Like, if any of the participants have any doubts on the portion which Dr. Tommy is being covering, so you can type that questions in the chat box or in the Q&A session. So after the webinar, I mean after the session or the presentation of by Dr. Tommy, we can discuss on all the doubts and all the questions and queries that participants have. So in top, I mean in the bottom corner, you can see a session like Q&A, question and answer session. So if any of the participants has got doubts on any of the topic which has been covered by Dr. Tommy, or if you feel to like ask some questions or something related to the topic, you can type in that. So once the presentation of Dr. Tommy is over, we can discuss on those questions and doubts. Sorry, doctor. Sorry for like interrupting in between. I just wanted to say this.
oh no, it's okay. It's really good. The more information they have, the better. So the better decision they can make and help make this presentation even better.
Yes.
I'm doing my best to get everybody
Yeah.
up to
Yeah. I
date.
appreciate that. Yeah. Please
Okay.
continue.
Thank you guys so much.
Yeah.
Okay, guys. Yes, just like I was talking about, the parasite prevention is probably one of the other big thing actually you can do for your pet besides the giving a good nutrition is parasite prevention. It needs to be used year round, in the sense that some of these medication will work forward, meaning that if you give it today, it will continue to work up to a certain time. I'm talking about mainly like flea and tick medication, because what it does is it will continue to basically provide you with the prevention you need. Things like deworming, usually, if the pets get dewormed today, whatever worm it has, it kills, get rid of it. But if they do pick it back up, they can get on, and the same is go for heartworm. They can pick it back up, and therefore, depending on where you are, you may have to deworm more frequently. And again, depending on which flea and tick medication you use, you may have to do it once or every 3 months or so. Okay, depending on the flea. Some are 3 months, because I know in Zambia we have the Brafecto and we have the frontline. The frontline is uh, a monthly prevention, and then the Brafecto is 3 months. The one we have understanding that they have a 6 months now, but there are other flea and tick medication that we're going to talk about here in the presentation. So the zero cream would be a good and comprehensive deworming. It kills hookworm, roundworm, and tapeworm. And then you have the Dirohard, which is a heartworm medication, and you're gonna see the different ones. Here's the zero cream is praziquantel, pyrantel, fenbendazole. Another dewormer is prambendin. You can use that also. Also, there's another couple made by the same company. So there's all kinds of different options that you have. When it comes to heartworm, same thing. You have the monthly, which is the Dirohard, and they come in different sizes depending on the size of your dog. Just know that, for example, this one also that does on heartworm and hookworm and roundworm. So this one, for example, won't affect any tapeworm. So if you're not using flea and tick medicine, it's possible that your dog can still get tapeworm with the Dirohard. So these are the different sizes again of the Dirohard. The other thing that we kind of talk about as far as the prevention is, again, we mentioned several things already, right? We talked about the make sure you keep your pet safe. The other thing we talk about good nutrition. We talked about the vaccinating. We talk about the flea and tick, ecto and endoparasites, as we call them. And then the other thing that is also very important when it comes to the overall health of your pet, you may not think of it that way, and many clients, I'm sure, don't think about it in that way, but it is really something you can actually do to help prevent to keep your pet healthy. I say that because pets that are not spayed or neutered, they tend to get certain diseases, right? One of them we talk about is the is on like, for example, for the female, we're looking at things like breast cancer. They can get that. Another one is, especially for females, is the pyometra. Another thing that also is quite important that people sometimes don't think about as matter of maybe keeping your pet safe, but if your pet is not castrated or not neutered, and in the male situation, for example, the pet female might be in heat somewhere close to you, far away from you. Your dog can smell it. They can sense it up to, from what I understand, maybe even a kilometer away. And what happened is that particular male dog, if it's not kept safe, like we were mentioning in the beginning, or keep him to where he cannot leave the yard, if he end up going out, he may end up, for one, getting hit by car, two, get into dog fight, and three, go and impregnate a dog of somebody else and then come back if it's in the case of the male. In the female case, if there's no male around and she is in heat, more than likely she will try to get out at a certain time of the heat cycle to go and become pregnant. And then they bring the female to you. Then she comes back home, and then now she's pregnant and with all these puppies. So many times people are not ready for that. And many times they end up giving the once the puppy are born, they end up giving it away to people that maybe shouldn't have any animals. One of the things that I always hear sometimes when clients come or when some vets are talking to clients is that, well, I don't want to, you shouldn't spay your pet too early because the pet may not grow properly, they may not this. Look, all of those are really valid points, but I think that a lot of these points, they need to be weighed with and make sure that we're giving clients the right information so they can make the right decision for their pet. Some people shouldn't have pets that produce other pets because, for one, they don't have the capacity to take care of the one they already have. For me now to start worrying about whether the pet is gonna grow and become, I don't know, maybe 50 kgs instead of 55 because it's paid too early, for that particular pet, it might be the best thing because I yet have to find a pet that walked into my clinic and I said, well, this one was paid too early, that one wasn't paid too early, because the difference really you can't see it. Unless, yeah, sometimes they end up with maybe hip dysplasia, something like that. But again, talk to the client, explain things to them, see where we are, and make the right decision. Because spaying and neutering, it helps a lot, especially in a place like Zambia where we have so many rabies cases. And many times there are so many veterinarians telling clients, no, wait till after the first heat. Then we fail to explain to the client that, okay, if the dog come into heat, the dog can get pregnant. This is what you need to do in order to prevent the dog from getting pregnant. Then I'm okay with that. Then at least the client knows when the dog has the right age or whatever you feel like is the right time, then you do it. Me, when clients come to me, once I'm done with the vaccination, pet is maybe 4 months. By the time we're done with all the vaccine, about 4 months. Usually starting 5, 6 months, I'm already talking to them about spaying and neutering, talk about the individual situation. Some pets, some people feel like, hey, it's a female dog, they need to have a litter. No, they don't. Another one, oh, it's a male dog. I hate to do that to my dog. No, honestly, these pets, especially even the males, right? They're doing it for procreation. They're not doing it for any other reason. They're not like us. They can process the same information like we do. Even for the female, that's why they only allow the male during the heat cycle. So please think about that when we are educating clients. And also as an owner, if you're a pet owner, think about that, because these pets, once they have all these puppies, the puppies have to go somewhere, because right now we're dealing with the overpopulation of pets here in Zambia. And we have all these rescue organizations that are always coming, knocking on our doors. Can you help me? Can you do this? Can you? But the problem starts with the clients out there. And many times we have veterinarians, we are contributing to the problem because we're not properly educating the client. So it's very, very important that we educate the clients as to being responsible owner, being responsible when it comes to your pet, do the right thing, and all that. Oh, another thing you hear, I don't want to hammer too much on this point, but I see this on a daily basis. Like, for example, last year, together just as a clinic alone, and me again loving surgery, I did over 800, maybe even more than that, castration and neutering for free for many of these organizations, only because I see the need in spaying and neutering. So because it's just such a problem when it comes to us trying to get rid of rabies, because that's, I feel like this is one of the big thing. Okay. The next thing that we're going to talk about is dental care. A lot of people don't realize how important dental care is for your pet. One thing I didn't know, I only found out, of course, when I got out of school, is that many of our heart problem, liver problem, kidney problem, they've kind of traced it back to either people or pets having periodontal disease, which is basically bad teeth, right? Because the stuff that is accumulating on the teeth, what we call tartar and plaque, is actually bacteria that is there. And what happens is, once that plaque is basically on rub against the gum, they start to cause tooth decay. The cement that holds the tooth together to the bone start to deteriorate, and then you have things like loose teeth. You have very bad on gum, because the infection now start to affect the gum, and you see dogs that mouth that when you open the mouth, you see the gum is all red, inflamed, bleeding. And once the gums start to bleed, all that bacteria that's on the teeth now has access to your bloodstream. And of course, once the bacteria is picked up from your bloodstream, it starts circulating in your system. They get stuck in your heart, get stuck in your liver, get stuck in your kidneys, and you end up having kidney problem, liver problem, or heart problem. So it's very, very important that we talk to clients about that. And also as clients, if you hear, it's also important that you have your dog teeth For one, you want a daily brushing. I know it's very difficult, but if you can get it even 3 times a week, it's still better than none. And then at least once a year, you have your dog teeth professionally clean. And it depends on the dog. As you're talking to your vet will on will advise you, and also as veterinarian, make sure we are making those recommendations to these clients because it's very, very important. Another thing that is important is we talk about geriatric care. Older pets need to be examined, like I said, at least twice a year, because what that gives us is it gives us the opportunity to basically check the pet, see if we see any early sign of any kind of disease, like things like kidney disease. They don't necessarily always just show up unless they ate something. Remember, I talked about toxic plants. So unless they eat something like this, some kind of poison or something like that, yes, they can get from day one or minute one to minute two, they can destroy their liver, destroy their kidney. As a matter of fact, I'm dealing with a case right now that we suspect that the pet ate something and it affected their kidneys, because 2 weeks ago we did blood work. Dog was perfect. Now dogs come back not feeling well. We did blood work, kidneys are gone. So in a case like that, of course, then it's nothing really you could do. But in a situation where you have an older pet, especially pets, once they start hitting 5, 6 years old, then you need to start talking to the clients already, depending on the breed, of course. The smaller the dog, the maybe a little bit longer you can wait. You can go more towards the maybe 5, 6 years, because then they become middle-aged and you can start checking. The bigger dog, I would say maybe 4 or 5 years. Then you can start talking to clients already about doing, even if it's once a year blood work. But definitely, if they come in twice a year, you want to talk to them about it. And every time the pets come in, always make sure you do a full physical exam, check the dog from head to toe, which is something I should have mentioned in the beginning. But again, now that we're talking about it, know your patients. And as you're doing these blood work once or twice a year, you're going to start seeing some changes on like your internal organ panels, as we say it. So you start looking for are there any changes in the kidneys, any changes in the liver. Then you start to make recommendation to the clients. Depending on what's going on, if you start seeing changes with the liver, thank God, the liver is one of those organs that we can detoxify. And milk thistle is one of the things that is probably one of the most important extract that you can have, that you can give to the pet. So something like a liver green would be a good idea to start putting the pet on. If it's a pet that start to have issues with his heart, maybe the heart is, you can hear a slight murmur, because the first thing that happens is you can start getting high blood pressure. Then something like a sildenafil, you can help. If there's a heart problem that is advanced, you start using your pimobendan. Again, these are all things that you can kind of look into, see how it goes, and based on that, you can recommend, like a hepacardin will help both the heart and the liver, and you can look into these things. Now, we kind of mentioned a little bit how to manage some common health issues. But again, it's very important that as you're doing your examination, you check in the pet, you have to go ahead and start making recommendation to this client if you see anything. One of the things you can is very, very important. We talked about it earlier, right? As you are checking the pet when they come in, you want to recommend to the client that they come in regularly. Like right now, we have some clients that are coming at least once a month regularly for grooming. Every time they come, we check the pet, see if they're on flea and tick medication, how is the skin looking. Depending on what it is, you may have to use some hypoallergenic products, because a lot of pets sometimes can have allergies, and the allergies can come from anywhere. But the number one cause of pet allergies is flea and tick. So anytime a client comes in and they said, my pet is scratching, my pet has skin issues, the first thing you need to check, does this dog have flea and tick? If you check that, or if the pet is already on a very good flea and tick medication, which we're going to mention some uh, in a bit, then you know that you check and the pet doesn't have any fleas or ticks, then the next thing you need to look at, is there any kind of allergies going on? What does the skin look like? And if we need to to address that, then we'll see what the most likely thing is. Because many times it can also be the food that the dog is eating, depending on what's in the food. Usually the protein or the carbohydrate are the two big things that they might be allergic to. There are some stuff outside that can be also causing infection or allergy. So here are some of the products you can use for flea and ticks that you can use. Again, you need to double check to make sure that you use the right size for the dog, and this will help with fleas and ticks. This is another one, fipronil, that you can use. It's a spot on that you can give to the dog. Again, depending on the size of the dog, you get the right one. Another thing sometimes that we see, especially around the rainy season, is a lot of pets do get fungus. When it comes to your cat, anytime there's any kind of skin issue with your cat, the number one reason, well, let me not say the number one reason, but one of the things that they do get that they have on their body is fungus. So we need to always rule out fungus when it comes to skin issues with the cats. So here are some products that can be used if you do decide, for example, that your pet has an fungus. Like the Mycoderm shampoo, for example, it has miconazole, chlorhexidine. All those things will either kill bacteria or fungus. So it'll be very good, what we call medicated shampoo to use. Another thing that we see a lot of also is ear infection. Many ear infection has been basically traced back to pets that sometimes swim a lot. Sometimes when the pet is getting bathed, if the ear doesn't get dry and it keeps the water in there, it can cause infection. Allergies can also lead to ear infection. Here are some medications that can be used to address those things. And yeah, so these are things that can be used to clean, and I'm pretty okay with doing a a ear swab on the ear, double check to see what is actually causing the issue with the ear, and then use the right medication. If you can, because the ear is too painful or something like that, then you can use something like silmazine, because you can see it as an antifungal, antibacterial, and anti-inflammatory, because many of these is sometimes they're so painful that sometimes they do need the anti-inflammatory. Sometimes we have to give them other pain medication, but these will be good stuff to use. Some pets can have digestive issues, and when it comes to digestive issues, depending on what the age of the dog, they can have either maybe parvo, which is one of these viral diseases. But of course, the good thing about parvo is up to a certain age. Usually, once the pet get older, they tend not to get parvo. They tend to be affecting puppies. Worms is also something that is quite important to always rule out, just to make sure. And then foreign body, of course, when it comes to your little puppies and stuff. So those are things that you basically see when it comes to your dogs. Cats basically kind of like the same thing. Worms is very important. Foreign body is important. Again, these tend to be more younger animals, not so much older. There are other issues such as allergies that can happen. Some of them, of course, things like cancer. So there's all kinds of a whole host of things, but have gone always, check with the vet. And if you're a vet, always make sure that you do a thorough exam, do your palpation, do your x-rays, maybe blood work, and just to see, because sometimes you could have like a kidney problem that is causing the vomiting, and it's not necessarily a digestive issue. It's more like a kidney problem that is causing the vomiting. If it's a diarrhea, it could be an allergy problem where the pet cannot handle that particular food or treat or something that you give them. And okay, so it's very important. Another thing that is also important to pay attention to is obesity. You want to provide a good balanced diet and, of course, regular exercise for the dog. Obesity can cause things like diabetes. And one of the big one is arthritis. Many pets that have arthritis and are obese, they tend to suffer more from the condition because of the extra weight that they carry in. So many times when it comes to heavier, bigger dog, the effect is so much bigger than when it what I mean is that the effect of the arthritis um, is so much worse when the pet is obese because there's a lot more pressure that's being put on the joint. So it's very, very important that you keep your pet basically in a good state. And a good state would be what we call a body conditioning score of 3. What does that mean is there are, the way we basically look at pets and to decide whether a pet is overweight, in good condition, or is underweight is something called a body conditioning score, where what they're saying is if you look at the pet, you shouldn't be able to see the ribs of the pet. At the same time, when you run your hand, let's say on the side of the body, you should be able with little pressure feel the ribs. If you have to push really hard to feel the ribs, that means the pet is overweight. So it's much more better way to think about your pets on weight than to actually look at the weight itself, because that by itself doesn't tell you everything about how if the pet is obese or not. Okay, it's very, very important. If you can look at the pet and you can see the ribs, that means the pet is too skinny. That means you need to add some more, put them on a better diet. Maybe you are over exercising your pet, or you could be over exercising and you're not feeding enough. So it doesn't mean that the pet is necessarily on a poor diet, but you need to give him, just kind of match the exercise to the diet. Okay. Um, Let me see, arthritis and mobility issue. You want to maintain a healthy weight, provide comfortable warm bedding, and use supplement like glucosamine for joint health. I think it's especially important for the bigger dogs. Any dogs will literally that's 25 or more kgs need to be on supplement at some point. I would say maybe once they hit 5, 6 years, they need to be some even earlier, especially if they have bad joints to begin with. Most dogs, you won't consider them having hip dysplasia unless they are an adult, meaning that they finish growing. So sometimes if somebody wants to know, hey, my pet, I'm not sure he's a big dog, I want to know if he have hip dysplasia or not. Usually you want to check them when they're like an adult, let's say about a year and a half, sometimes 2 years if it's a Great Dane or one of these giant breed. If it's a little bit smaller dog, again, they tend not to suffer from from the same issues like the bigger dog. Or many times because of the small sizes, you don't see the effect as bad, but they do get it also. So I don't want to sit here and say that they don't have mobility issue, they don't have arthritis, they don't have hip dysplasia, but they tend to be less of an issue for them than it is for the big dog. Again, this is one of the joint supplements you can use that helps with rebuilding the cartilage, have joint fluids, and help mitigate the I would say the bad effect that arthritis has on the joint. So this is a way of you trying to basically help the dog to reduce the effects of arthritis. Another big thing that we see many times with a lot of these dogs is some behavioral issues that sometimes they can have, and many times this is one of the main reason why many people are getting rid of their animal, and it's very sad because many of these things can be prevented. Many times they can be trained, and it is very, very important that you kind of realize these things early, and work with the dog. And you want to wait. You want to start when they're quite young. You don't want to wait till they're too old before you start trying to manage their behavior because they can start as early as, I don't know, 8 to 10 weeks. I was told, I'm not a behavioralist, but I've spoken with many people and they said the earlier you start, the better it is for the dog. When we talk about training, you always want to use positive reinforcement to teach obedience, good manners. Many times, for example, you've had situation where the look at the picture that I just showed here, where the dog threw the plant, right? This could have happened in the morning. The client comes in the afternoon. They see the plant there. The dog is sitting there, maybe even napping. At this point, you can tell that this probably just happened, just the way the dog is looking. He looks like he's guilty. But anyway, if it's a situation where you see this, the dog is maybe in the bedroom lying on their bed, and you come and you see this, and you rush to the room, grab the dog, and start beating the dog because of this. In the meantime, the dog is not even near this. Even if it is needless, if it happened an hour ago, the dog doesn't even remember this happened. It's there. You can see it. The dog maybe can see it, maybe it's, but it's not the time to now go and start to correct the behavior. Many times with these things, you want to do it as it happens. If it just happened, you can correct the dog and try to always, be firm with the dog, not start hitting the dog because sometimes again they cannot they can't relate, they can't put it, but something like a good no, and be very, very forceful. If you have maybe something to get their attention as they're doing it, maybe you clap in your hand and say no, and to kind of startle them so they can see, hey, what I just did, and I can see that my dad or my mom didn't like that. So sometimes that might help. But anyway, there are things that we can do. The other thing you want to do lots of exercise with your dog, do some uh, mental stimulation, daily walk, play with the dog, do all kinds of different things with them, keep them busy. One of the other thing actually I want to go back to is we have a lot of people, especially here in Zambia, that say, I want a dog to protect the family. It's a great thing to have, to aspire to. And of course, we all would want that. The one thing sometimes people forget that when you have a dog that bites and you don't want to train your dog to bite people, unless you train it to do very specific things, like if it's, people is behaving a certain specific way, okay, that can be quite specific. And I don't know if you can even do that sometimes, unless you are doing some training, like I have some friends from North Luangwa that are watching now. They're doing very specific things with some of these dogs, so where they behave a certain way around specific things. But when it comes to, like, I just want a dog that will bite people, for example. Okay, me, I don't want to neuter my dog because I want my dog to be aggressive. I want my dog to bite people. Of course, nutrient doesn't always necessarily change the behavior in that sense. If a dog bites already or is been used to biting, even castrating the dog may not necessarily help. But anyway, a dog that has been castrated, or a dog that you don't want to bite people, meaning that you've introduced him to other people, he's been around people for a while. What you want is a dog that makes noise, because many times once the dog know that he can bite anybody other than you, he will bite the wrong people, because you're more likely to get your relative to come, you're more likely to get the neighbor kids to come. It's more likely that you will have somebody over for a meeting that the dog doesn't know, and the dog may end up biting that person. And there's all kinds of horror stories that we've heard where dogs have killed kids, have done all kinds of stuff. So just be careful sometimes when you are talking to people and they want these dogs that bite people, because somebody that's gonna come, if they don't know that the dog doesn't bite, they'll just be scared because of just the fact that the dog is there. They'll be scared. And then the other thing sometimes you will see is that some of these animals sometimes, um, because they don't know a thief from the next person, this person doesn't belong here, so they just bite anybody. So again, when you are training the dog, just make sure you're training them for the right reason, for the right things, and always try to be responsible. Again, we talk about separation anxiety. There's many things you can do. Sometimes there are certain behavior you can try to instill on the dog, let the dog understand that you're not always going to be around. So sometimes if the dog is a dog that is very anxious, you can have some toys for them to keep them busy, something like lick mats. The other thing is sometimes you may want to leave for a short period of time, come back, so the dog know that okay, this person is coming back, they're not just leaving. Again, we talk about aggression. Sometimes, again, a dog might be aggressive because he is in pain. Some dogs that's in pain will bite you if you touch that area, touch him, do this. So always, when a pet, somebody brings in a pet that they think has aggression problem, make sure that the pet was not didn't come from a place where they made them aggressive by doing certain things to the dog to make them aggressive. But you can always rule out some medical issues first, just to make sure. Have the a vet look at your dog, do some things, and then we can work on the aggression. Dogs that are doing excessive barking, chewing, again, you want to redirect them to the appropriate outlets and toys to help find out what is causing the dog to bark. For example, at home, we live on a farm, and sometimes we have some wildlife around. Unfortunately for us, we can't do anything about the fact that there are wildlife around. So anytime these dogs hear some of the wildlife, they start barking. So in your case, it might be something different. Maybe a light comes on. I don't know, maybe a neighbor is playing music, whatever it is. So try to see what you can do to help and then reduce the barking, or correct the dog as it's barking at the right time. As soon as they start, whatever it is that has happened, if you don't want the dog to start barking at the music, for one, you start maybe be around, check. As soon as the music start, the dog start to bark, you need to let them know, hey, no, don't. Okay, and start talk, because sometimes you can't go and talk to your neighbor to stop playing music, because again, they're in their own property, they have the right to do whatever they want. So those are the things to kind of look at. I came to the end of the presentation. I want to thank everybody. I hope it was you learned something today, and I just want to give all the best to everybody. Thank you.
Yes, doctor, it was a wonderful session. I think everybody has enjoyed the session. So I think now we can go to the Q&A session. So Mr. Kalilo Hazemba has asked, papilloma being a viral disease, can it also be led by allergies? I think maybe people, I just want to announce one thing, that if anybody has got any doubts or anything related to the topic which Dr. Tommy has covered, you may please feel free to ask in the Q&A session, or if you want to know something related to pets or pet animal medicines, or maybe something related to pet animal management, whatever it is, you can always please feel free to ask the questions. You can ask the questions in the chat box or in the Q&A session. So I think Doctor will move to the Q&A session, right? So I think you can
Yes,
start with answering the question from Kalilo, where he has asked,
yes.
papilloma being a viral disease, can it also be led by allergies?
It's very difficult to say. What I know, it is very contagious, meaning that if a dog has it, chances are the dog got it from another pet. I'm not sure if it's something that just on I would say spontaneously develops. So many times you see it in dogs that has been around other dogs, maybe come from the shelter, maybe been playing with other dogs, and the other dog may have had it, and then they either lick the dog, because I think it comes even through contact, from what I understand. Can allergy cause it? I don't know. If a dog is licking, it's possible that they could. No, I'm not sure, to be honest with you. I'm not sure, but I think it is a contagious disease where they can pick it up from another dog. And usually we tend to see it in younger dog also. Usually they'll be, maybe a year or less, maybe. And the good thing about the papilloma virus is it tend to be self-limiting. So if they do get it, usually it will go away. You don't have to try to cut it out or anything like that. But I've heard also where people have cut it off and they fed it back to the dog. But from my perspective, the way I've always handled them, when I see them, I just leave them alone unless it's affecting the dog eating, drinking, maybe they're bleeding a lot, then maybe I can go and start maybe removing them. But the way they get it, from what I understand, is just through by them by direct contact, I would say. Oh, we can't hear you.
Yeah,
We
doctor,
cannot
am
hear
I
you.
audible now? Yeah.
Yes. Okay.
Yeah, thanks very much, doctor. So, another question has been asked by Mr. Jacob. Like, apart from power paste, that would, I think he meant the Nutri Power paste. Are there other
Yes.
vitamin and mineral supplements recommended brands within Zambia?
You know, to be honest with you, I'm just one of those doctors that because I have the ability to sell pet food that are nutritionally well balanced. I tend not to, I would say, sell on supplements. But at the same time, if you DM me, if you have one that you are looking at and you want to get my opinion as to whether it's a good one or not, then definitely DM me because I don't use it. I'm not too familiar with them other than the one that I just mentioned. But unfortunately, I don't think we have this one in Zambia. So maybe we can talk to the people at ALS to maybe bring some of that into Zambia. It would be great because a lot of the products that we just spoke about, they're not available here in Zambia.
Uh, Mr. Alimon Sakala has asked,
Yeah.
has given in the chat box that he has appreciated your session as a very educative lesson. And he has
Oh, wow.
asked, is it advisable to treat some dog diseases using human antibiotics, for example, metronidazole in cases of parvovirus, parvoviral infection?
Yes. Yes. Look, honestly, I can't think of any vet that will treat parvo and not use metronidazole. Unfortunately for us, you know, many of the medication we have, they're all human medication. So yes, you can use it. Make sure you look up the appropriate dosage and then give as needed. But it's very, very vital in treating parvo. And make sure, of course, just talking about parvo, make sure you hydrate the pet very well. You have him on your metronidazole. Sometimes the sulfur medication, they have some antiviral sometimes also that you can use. And in the US, they have some other medication that can be used. But the main thing is you want to prevent infection and you want to make sure that the pet doesn't dehydrate. Those are the big thing with parvo because you can't do anything about the virus. It's what the virus does. You try to mitigate that because most pets, they don't necessarily die from the virus, but they die from what the virus does to the body. So just make sure you keep the dog well hydrated. You are force feeding the dog. Like for example, if you had that Nutri Paste, it would be something you can be given to that dog. Make sure you, if you have proper nutrition, even though the virus attack the intestinal tract, just force feed that dog every day. And even if it's a little bit of nutrients that that dog gets, it will help mitigate the and keep the pet going until the virus run through the body, which takes maybe 4 to 5 days, sometimes can up to 7 days. But the first 4 or 5 days is very critical. Okay.
Yes, doctor, it is very clear. Yeah, the main cause of death due to parvoviral enteritis is dehydration. So, treating the
Mhm.
dehydration and treating the secondary bacterial infection is very much important. So, I appreciate
Yes.
your answer. So, if anybody else has some questions, you may please feel free to ask. We have some more time for discussion. So, Mr. Jacob has asked another question, like what kind of cancers can be prevented by spaying or neutering a dog male, and what is the best time to do this? To do this.
Wow. What a question. It's a great question. Um, the main cancers are what we call breast cancer in the females. Is the you prevent breast cancers with the female, and some of them can be benign, some can be malignant, and most of them sometimes I would say are even malignant. So depending on how bad they are, sometimes we have to check to make sure it hasn't spread to the lungs before you even do surgery. But yeah, for the male, it's usually prostate cancer is the one. As a matter of fact, many times when you have some of these pets that comes to you and you are treating them for, let's say, like maybe a urinary infection, sometimes it can be coming from the prostate. So one of the things that you do, if you castrate the dog, you prevent them from getting, even if it's just hyperplasia of the prostate, you prevent them from getting prostate cancer. So those are the cancers that you are preventing when you do spay and neuter. So it's something we need to be offering to our clients. I think, and from what I understand, is that if you do the spay before the first heat cycle, they're less likely to get breast cancer when they're older. So that's why I'm a big advocate for early spaying and neutering, because it helps with that. Of course, I know one of the things that a lot of veterinarians are mentioning to clients, well, if you spay your dog too early, they might get incontinent when they're later. But there's a very, very low chance of that happening. And think about it. If you explain to the client and the client get to pick, do you want cancer or you want the dog to have the so which one do you want to rather deal with? I guarantee you most clients will say I rather not deal with the cancer. So again, think about that as you are talking to the client and do the right thing by the pet, depending on the situation, of course, then you talk to the client.
Perfect, doctor. So I think that does the answer for the question. That was an interesting question. Yeah. So some anonymous attendee has asked, "Can you kindly send me the adequate parvo virus treatment because I have been having problems in treating parvo at my clinic."
Wait, I'm so sorry. Can you repeat that?
Yeah. He has asked, can you kindly send me the adequate parvovirus treatment because I have been having problems in treating parvo at my clinic.
Okay, it's no problem. What you can do, I don't know if you have my information or, but we can always discuss and talk and see what you might be doing wrong. I'll maybe better that I have a one-on-one discussion with you. But at the end of the day, what is important with Parvo is really two things, basic for all Parvo cases. For one, also, always make sure that these dogs are dewormed, eh? Because not all the dogs that are having bloody diarrhea are powerful dogs. That's one thing. Because if you're not treating if the dog has deworm, especially hookworms, they will have bloody diarrhea. You may think it's powerful, and then you keep giving them fluids, and giving them antibiotics. In the meantime, the dog is loaded with worms, and you've never really actually treated the worms. The other thing also that is important is that you are doing some proper testing just to double check, make sure it is powerful. But at the end of the day, we all have smell what powerful smell like. And if you do treat the dog for powerful, even if it's a dewormer, you're more likely to save that dog than not. But the main thing with powerful is make sure you have them on a drip and keep them on the drip, even if the drip is running very, very slowly. But make sure because that dog needs to be hydrated the whole time, especially if they're vomiting and having diarrhea. Those are the main thing. And then keep them on a very good on an antibiotic, something like a metronidazole. Sometimes if the dog doesn't cannot take medicine by mouth, you can always, because the metronidazole also come in IV form, you can give it IV. And then sometimes you can add maybe a penicillin in there. You can add like a gentamicin. So those are the things you can use just in general, but always give me a call so we can discuss and see there could be maybe you're doing something not quite right, or maybe at the time you get the parvo is so far gone that really there's nothing you can do because believe it or not, you can only save maybe with the treatment we have now, if you're in the US, maybe you can save 70% of them. But really in Zambia is a 50-50. You might be lucky if you get 60 or 70%. So if you get in half of it right, then you're doing most things right. Okay, if it's less than that, then maybe we can see what else we can do to add and go from there. But the nutritional part, don't forget that. Make sure you are giving the dog, try to force feed the dog as you are treating it, and we can talk about that, what to do.
Yeah, great, doctor. So I think if at the end of the presentation or after this webinar, we'll be sharing the details and the detailed presentation and contact of Dr. Tommy. So all the participants will be receiving that through email. So if you have further doubts regarding treatment of parvo or any topics, you can even directly contact Dr. Tommy, or you can contact with the clinic of Dr. Tommy. So that is fine. So I think, but the answer he has given the basic answer or the details regarding the treatment of parvoviral enteritis. So another question asked by Benjamin Van Zyl is that what would be the best treatment for trypanosomiasis in dogs? As we know that not a lot of research has been done in dogs with this sickness. What would be the symptoms, especially in Zambia, as we have seen some newer symptoms in some dogs?
Yeah, look, the funny thing about trypanosoma is that the symptoms are very vague in the sense that, but the one thing that is pretty consistent of all the dogs that we have seen that we have confirmed had trypanosoma, they all run a temperature. So anytime you have a dog that is running a temperature and you are in an endemic area, because trypanosoma is not found everywhere in Zambia, for example, like in Lusaka, I had a guy came to me once and said that they did find trypanosoma in his dog here in the area, but that's probably the only case I have heard of or have seen, because we do send a lot of blood work, especially pets that are traveling to South Africa, and they do test for trypanosoma because they don't want a dog that has trypanosoma to go there. So we've treated over the last probably I would say 6-7 years. I've sent quite a few dogs from Lusaka to South Africa, and we did the trypanosoma test, and they all have come back negative. So I don't think it's a huge issue here when it comes to Lusaka, but certain parts of the country, like the northern part of the country, there is trypanosoma there in some of our national parks. Even there's one big one called Kafua, North Luangwa. I think South Luangwa, they have it. Anyway, basically they have safe flies. You will find it because that's the factor that carries it. But yeah, so the big thing you will see, usually the pet might stop eating, stop drinking, temperature will be up. Then, of course, if it's in an endemic area, then it become highly suspicious. Then again, in cases where we know there's quite common, usually we go ahead and then there's a couple of protocols that we have. One is Samarin that we give to the dog. We give one injection, and then the other protocol is a medicine called retinol imidazide. I think is the name of the. I can't think of the on top of my head, but it's retinol. And then we give that. Then we add something called Tagera Forte with that, and we give the Tagera Forte for 5 days. One of the other thing also that we have discovered in many of the dogs that do get on trypanosoma, sometimes they do get some kind of tick bone disease with that. We've had some that has had babesia with the trypanosoma. So many times what we do, we also go ahead and we recommend to put them on doxycycline for at least 10 days. And many times that has helped us. Most of the dogs that we put on these protocols, they tend to do well. And the specifics, I can always give it.
Okay, doctor. Okay. So Benjamin Van Zyl has also told that on the parvo,
Mhm.
Is it true that
Mhm.
parvo lies in the ground, say, in your kennel area or on your yard? If so, what can you use to get rid of the parvo completely to prevent it for the next litter that is coming around?
Okay, thank you. It's a great question. Yes, parvo can live in the environment for a long time. I've heard of cases where it's been in the environment for years. Now, one of the things that you can use, of course, is on a bleach that you can use. The other thing also that is very important is that places or areas where there is direct sunlight. So if sunlight can get directly onto that area, then that also will dry out the virus and the virus can be eliminated or killed that way. So if it's an area that you can open up the area, let's say there was a tent that is over the area and the dogs had parvo in that area, then you open it up and let the sun dry for maybe a few days or so. That will also kill it, but you always want to use something like bleach and just spray the area. What I've been told in the past is that you can use a mixture of, let's say, a 50-50. So if you use something like bleach, you put 1 liter bleach, you put 1 liter water. It's very, very strong, but then you spray the area really good and let it sit for like maybe an hour, couple of hours or so. Then you can go and mop it. And then the other thing is to any area that you can clean, you can mop, you can scrub. Those are the areas that you want to do that with bleach and just scrub it really good, and that will should eliminate the virus. Even if you many of you think about during COVID, that's one of the things they were talking about, right? Use hand sanitizer, and also make sure that if it's an area that, let's say, you do have parvo there, whoever is coming in, make sure they're not the one bringing the virus. So you need to know your people that are looking after the dog. Make sure they are not the one bringing the parvo to you, even though your place might be clean. You're thinking, oh my God, it's me. But in the meantime, it's where that other person live. Maybe a dog was there, they didn't know, and they're the one bringing the thing. So if you do have puppies, just watch who is coming after the puppies. And the main thing is, if you're gonna have puppies, let's say it's a dog that you breed yourself. Make sure that the mother and the father are both vaccinated against parvo, because if the mother has the antibody, she will give the antibody to the puppies. Or if, in case of a different virus, if it's a kitten, they will have it. Then when it's time, because from what I understand is once a mother gives the puppy antibody, the antibody will last up to about 6 weeks. Then from 6 weeks on, that's when you start your vaccination. Between 6 and 8 weeks, you want to start the vaccination, and you need to vaccinate beyond 3 months. So if you do 6 weeks, you do 6 weeks, 10 weeks, and 14 weeks. If you start a little bit later, let's say you start at 8 weeks, you want to do 8 weeks, 12 weeks, and 16 weeks. So you want to vaccinate beyond 12 weeks. Anytime you're going to vaccinate against parvo. But if the mother has parvo vaccine, the father has parvo vaccine, then the puppy tend to be better. And then the other thing too is if the mother gives birth, make sure that the puppies get the first sets of milk. The because that's when they transfer most of the antibodies to the puppy. So you could be vaccinating the dog properly. All that is done, but if the puppies don't drink the first milk with all the antibodies in there, they may not get the full effect of the maternal antibody. And the longer they wait to nurse, the less antibodies that they get. So the first sets of milk is the most important. The first 24 to 48 hours. So you don't want to remove the puppies from the mother, thinking, oh, the mother is this, is that. She might kill them. Let me remove them, and then they never get the milk for the first 48 hours. In that case, then you can go and try to milk the mother yourself and give the puppies the milk, or you need to figure out what you're gonna do. And maybe you may have to vaccinate starting earlier, maybe 4 weeks or so.
Yes, doctor. So great. So Wilfred has asked, like he has told
Mhm.
that nice webinar. Please share the presentation. So I'll give an answer for that. Uh,
Yeah.
select- So he has told that nice webinar. Please share the presentation. So regarding the presentation, like all the countries where Ashish Life Science, our company has got an application called as ALS Cares. So most of the people who has joined the meeting would be aware of that. And if at all you are not aware, we have an app called ALS Cares. So in all the countries where we have the ALS Cares and participants from those countries, we will be uploading the webinar presentation in ALS Cares app. And there is a session in the ALS Cares app called as the Knowledge Center, where this webinar presentation will be available. And also, you'll be getting an push notification once we upload that in the ALS Cares app that then the PowerPoint presentation for so and so webinar has been uploaded in the Knowledge Center. So we'll be uploading it in 1 or 2 days. And in remaining countries where our ALS Cares app is not there, to all those participants, we'll be sharing the webinar presentation directly. And other than that, people like almost in 10 countries, we do have our ALS Cares app currently. So in all those countries, we'll be sharing we'll be uploading the webinar presentation or PowerPoint presentation in the ALS Cares app. And people who have registered for that will be getting a push notification regarding that. So anyway, within 1 or 2 days, once we finalize the and do the final modification, we'll be uploading it in our ALS Cares app. So no, all the participants and all the people who has registered for the webinar also will be getting the PowerPoint presentation. So need not worry on that. So I just when the question came, so I just answered that. And Dr. Tommy, another question has come, like where he's asking, what are the vital signs that a dog is poisoned, and what is the immediate treatment plan?
Well, look, when it comes to poison, the first thing you want to do, depending on the kind of poison that the dog takes in, right? Something that, for example, one of the most common things that dogs get poisoned with would be rat poison. Um, the first thing you want to do is see if you can get the dog to vomit. One of the quick thing to use would be hydrogen peroxide. You give that to the dog and you let the dog walk around. Usually, you want to give about maybe 1 tablespoon if it's a small dog. If it's a bigger dog, you want to give it maybe 2 tablespoons or 3 tablespoons, depending on the size. You walk the dog around for like 5 minutes. If they don't vomit, you give it again in another the same amount again, another 5 to 10 minutes. Usually, once you give it within 5 to 10 minutes, the dog will be vomiting. One of the thing also is important is how when the poison happened. If the poison happened the day before and now you realize it, I don't know if the vomiting will help. Another thing that you can use at what I'm going to say now, the next thing you can use is charcoal. You want to give the dog some charcoal because the charcoal goes and binds with anything that's in the stomach, and it will hold on to it and basically take it out all the way out to your bums, okay, to the dog's bums, if that's the right word. But it will go through the digestive system while it's holding on to the poison. So that's probably the two biggest thing you can do. Then depending on how the dog is feeling, if you do take it to the vet, then we'll do things like symptomatic treatment. Usually we put them on a drip to help flush the system so the thing can be either pee out or again stimulate the intestine so the pet can go to the bathroom and poop it out. But the main thing with poison is definitely try to get it out. Now, certain poison you don't want to come back out. For example, let's say somebody gave the dog something like ammonia or something like that. Then something like that, you might want to use something like charcoal and just give it the charcoal so it binds to it and then flush the system. Because what happens is some chemicals, as it goes inside the intestine, it burns the intestine as it goes down. And if you try to make it come back up, it will burn again and it might cause more problem. And you may not be able to get rid of it altogether. So instead of rushing trying to get hydrogen peroxide, if you have something like charcoal, then you want to give it charcoal and you put them on a drip and just monitor. Many times you're able to save a lot of these dogs, but sometimes, unfortunately, because of quick absorption and all that, it may already cause damage to your liver and your kidney. And then when that happens, nothing really can save the animal. So yeah, when it comes to poison, if you can find out what it is, then try to either let the dog vomit or give them something like charcoal. And then again, if you're a vet, put them on a drip. And then if there's a specific antidote, like even the other day, for example, we had a dog come in, he had organophosphate poisoning. Atropine is an antidote. So something like that, then you give something atropine, then it will help to mitigate the um, the effect of it. So always, if you have an idea what it is, try to, even if a client tell you, I think my dog ate poison, then try to get the label, and then you can always Google it, check what it is, and then see what the best way is to take care of it. But in general, making the dog vomit to get rid of it, or something like charcoal will help a lot. And then the other thing, like I was saying, timing is also important because you don't want to waste time trying to get a dog to vomit where the thing has happened 2 3 hours ago. So that's not gonna help.
Yes, doc. That was informative. So, Philbert has asked. I think we'll answer one or two questions, and we can wind up the Q&A session. So, Philbert, vet technician, has asked. Good afternoon, doc. Can ivermectin be given to a dog on the same day as anti-rabies vaccine? And how can we approach the issue of ethno-veterinary route of treatment? That is, use of natural remedies for treatment. Asked by Mr.
Oh,
Philbert.
okay, let's repeat that question again.
So I'll ask the first question. That is, can ivermectin be given to a dog on the same day as anti-rabies vaccine?
Yes, you can. And the reason I say that is because, for example, one of the heartworm medication that we mentioned in the presentation has ivermectin in it. So if a dog comes in and they get the rabies vaccine, you can give that medication. So the other thing is just make sure you give in the right dose. So you want to do the calculation and make sure you give in the right dose. So if you give the right dose, I don't see any problem. You give in the rabies vaccine and ivermectin, because a lot of people use ivermectin as a dewormer anyway. So yes, is you can deworm the dog on and given ivermectin and give anti-rabies at the same time.
Wonderful, doctor. And the second question is, how can we approach the issue of ethno-veterinary route of treatment? That is, use of natural remedies for treatment.
Look, I'm a big believer in whatever is effective and it's been. You can always prove, quote unquote, that, especially when it comes to natural remedies. But think about something like liver green, for example, right? It has something like milk thistle in it. Milk thistle actually is a plant, so, and it's very good for liver disease. So I'm a big proponent of using natural remedies, but again, it just depends on what it is, and make sure that whatever it is that you're going to use, that is not toxic to the animal. You can always Google that, but yes, many of the medications that we have are natural. Sometimes we don't realize. For example, I talked about the liver green, for example. It's a great example where it's basically all natural. So, and many times the good thing about natural, you can't really necessarily overdose the animal because the body takes whatever it needs, whatever doesn't need comes back out. So, but just be careful what natural you use. Always Google, check, double check, and then. But yeah, you can use natural for to treat. Again, even with parvo, it just came to mind. You didn't ask specifically about parvo, but again, just be careful with that. The main thing with parvo is make sure that the dog is on fluids. It's very, very important.
Okay, okay, Doctor. Great. So, Chitalu has told that thank you for the powerful presentation and kindly share the presentation too. So, as I have explained to all the participants, you will be getting the webinar presentation or PowerPoint presentation. All the countries where we have the ALS Cares app, it will be uploaded in the ALS Cares app, and remaining countries, it will be sent directly to the people who has registered and also participated in the webinar. Yeah, so that would be done. Then Dr. Adain Saifu has told, nice webinar. Thanks, doctor. So the chat box is flooding with all the, appreciations for your webinar.
Oh, wow.
Then, yeah, then Kalilo has told that, thank you, doctor, for the answer. There was an ankle, I was looking at it, but question answered. And just an addition on parvovirus, it is also very important to disinfect our working environment more, especially in clinics, because you find that if some measures are not taken in the clinic, it can also be a hub for the infection spread. Yeah.
And I definitely agree. I specifically didn't get into that because again we are professionals. So especially from our perspective, because sometimes client thinks that they come there and they get parvo from our place, a place that is well cleaned and well taken care of. Pets should not come to your place and get disease there. So therefore, we need to make sure that we are cleaning the environment on a regular basis, not just in the morning, throughout the day. Anytime you have a pet that has parvo, when you're working with parvo dogs, make sure you wear gloves, get rid of the gloves. There's a special section in the hospital where you treating those type of animals and you don't bring those animals in other areas. So you need to separate area just like we separate our surgical room from other areas of the clinic. So those are basic stuff, and I'm glad you brought it up. And I specifically didn't talk about that in that sense because again, as veterinarian, we should be professionals and know that. But thank you for bringing it up, and it is a very, very valid point. And thank you for that.
So, in continuation to the question of poisoning, Kalila also has
Mhm.
asked, can you also use liquid paraffin for poisoning?
The reason I wouldn't look, I don't see how the liquid paraffin will help unless it's, yeah, I can see how liquid paraffin will help because liquid paraffin will cause, I would say, it's a laxative in a way, right? So, but with poison, you try to prevent absorption, and I don't see how that will prevent absorption of the poison. So therefore, I wouldn't use it as a way. Now, if you have a dog that has an obstruction, then yes, maybe as part of that, you can use liquid paraffin, but not necessarily for the poison part of it, but it's to help move things along. If you worry that the dog ate something where there could potentially be a blockage and it, I don't know, poison, then I would give like maybe the charcoal for sure. I would give that. If it's something to where you worried, because the other day, for example, we end up having a dog that had eaten plastic, burnt plastic. The dog ate it. We didn't find out, of course, almost a week later. But something like that, for example, if the dog ate it, it might get stuck there and it can't come back up. Then maybe something like a liquid paraffin may potentially help move it along. So those are the way I would use liquid paraffin in the poison case. But if it's purely poison, they brought it and you give liquid paraffin, I don't see how that will help. You might as well just leave the dog alone. And you might have a better chance of maybe giving the dog fluids because that will help speed up things to where the dog, again, is just talking hypothetical here, but the biggest thing you can do for the dog is get the dog to vomit, for one, so they get rid of the poison. And two, you want to give something like charcoal. So you want to have charcoal available. Those are the big things I can think of at the moment when it comes to poison. And then, of course, antidotes in the case like organophosphate. Sometimes there's something called yohimbine. If a case where you give the dog, and if the dog was being dipped for ticks. Again, I didn't talk about the dipping because I personally don't believe in it. I don't think it's something we should be using in this day of age. We should be using things like your Brafecto, your some of these the other products that we talk about today. The reason I'm mentioning Brafecto because a lot of these products we don't have them in Zambia, but those are the products I would use the appropriate flea and tick medication rather than amitraz or something like that because those things can be poisonous if not mixed properly. So I'm not a big fan of those. But yeah, that one has an antidote, yohimbine. You can use that to counter the effect.
Yes, beautifully answered, doctor. So I think we'll wind up the session with last two questions. So Mr. Benson has asked, "Good afternoon, doctor. I have read somewhere that chocolate is poisonous to dogs. So how true is it? And if it is true, then what is the content that makes it poisonous to dogs? And how can we prevent poisoning in that kind of poisonings?"
Yes. Okay. Chocolate definitely is poisonous to dog. I can't think of the active ingredient in. I think it starts with a B or something. I can't think of it on the top of my head. But this is what I can tell you about chocolate poisoning. The darker the chocolate, the worse it is. And the more it is, the worse it is. So if it's a dog, for example, that ate milk chocolate, for example, and you know these milk chocolate, these Cadbury candies that we buy, and it's just one, not even one strip, one of because those things are, I don't know, they kind of in little cubes, right? So let's say a big dog like a German Shepherd eat one of those cube, a piece of it. I wouldn't get as concerned that he ate the chocolate because that's more sugar and milk than it is chocolate in there. But if it's the dark chocolate and he ate like a whole, I would say a whole strip of it, then yes, it can. Many times, what the chocolate does, it can affect the liver, so it can cause liver failure. So the first thing you want to do, that would be one where you want the dog to vomit. And so you try to get the dog to vomit. And if it vomits all up, then you should be fine. And then of course you want to put the dog on fluids. And in if a case like that, then you may want to use something like liver green at the end of it. And make sure that you put the pet on that to help to protect the liver. So that would be the way I would approach like chocolate poisoning. But yes, so dependent. So if you have a dog that did eat chocolate and maybe didn't die, chances are they ate milk chocolate and probably not a lot. But if it's the dark chocolate that they use to cook to make cakes and stuff like that, and because I had a dog, two dogs one time, the owner made a big cake and both dogs when I think something went wrong with the cake and the client went and dumped the cake in the garbage. Two Labrador went and they just chowed at that thing. And the client, of course, rightly so, got panicked. And she brought the dogs to us, and luckily we did have the hydrogen peroxide, which is something I keep here. And make sure also when you do give the hydrogen peroxide, make sure you give the 3%. So think about that, because here in Zambia, for example, they sell the 6%. So you want to dilute it to 3% 1 to 1. So if you put 1 ml hydrogen, 1 ml water, 1 cup hydrogen peroxide, 1 cup water. So just to kind of give you an idea. But anyway, you want to give about maybe a couple of teaspoons, 2, 3 teaspoons at a time, and get the dog. And these dogs, they vomited up the whole exam room was full of cake. So in a case like that, where you got most of the cake out, then you don't have to worry so much about the poisoning. But then you put them on a drip, monitor the dog for the next 2 or 3 days, and if you're worried, we can always run blood work a few days later, see where we are with the liver, get something like liver green, and then you put the dog in there. In Zambia, anything to do with the liver, it has to have something like called milk thistle in it. So anything with milk thistle, if you go to many of the pharmacies, they will have medicine that says liver, you know, anything that says liver on it, you can actually use. But the big thing is milk thistle is what you want to use, and it's in the liver green. So if you look that that picture again, you'll see it in there.
Great, doctor. So I think we'll move to the last and final question. After that, we'll be moving to our lucky draw. So actually, two questions is there, but both are related to vaccination. I think you can answer it as a single, like you can answer it together. So
Mhm.
Faith has asked, can we give two vaccines at once, like rabies and parvo? And Lucas has asked, some diseases which are not related with virus base cause. Example, tick-borne diseases. My question is, if the dog is sick with tick-borne diseases, is it okay to vaccinate the dog while he is on treatment? So these two questions are related to.
Okay. Yes, they're together. Okay. Well, let me get the first one is a simple yes. You can give more than one vaccine at a time, but again, it's all about timing, right? For example, if a 6-week-old puppy comes into your clinic, right? A dog like that is too young, or a cat is too young to get the rabies. So you wouldn't want to give them the rabies vaccine and the cat flu, which is the other vaccine we use here. But if it's a dog that is 3 months or older, then certainly you can definitely give him both vaccine at the same time. And then the second question was, can you repeat that again? Sorry, there's a lot happening in my head.
Yeah, he has asked some diseases are not related to
Oh, yes.
virus break. So he's asking whether if an animal is under treatment for some tick-borne diseases, can that same
Uh-huh.
animal be given or can be vaccinated while the dog is
So,
in treatment?
yeah, one of the things that you need to think about when you think about vaccination, dependent, of course, with the vaccine. For example, the rabies vaccine is a little bit different, so I'm not going to include that in the answer, but you need to consider that as part of the answer. So, the reason we give vaccine, or the vaccines that we give, let's say talk about the parvo vaccine, right? It's an attenuated vaccine, meaning that it's actually a vaccine, it's actually the disease that we give to the pet. So you got to think about it in that term. So now, let's say, for example, you have a pet that comes in and is healthy as it can be, right? And you give it that vaccine, we know what's gonna happen. The body is gonna take care of that vaccine because the disease is been given in a in a way where we know if the body is healthy, it will kill the virus basically and form antibody against the disease. Now, let's say you have a pet that is already fighting something, and here you go, you give it something else to try to fight also. So think about it in those terms. So it's not so much that the dog is sick and you're trying to vaccinate. It's just that the body is already in a weakened state. And here you are, you go and give it something else that it needs to fight in order to build antibodies, because that's what the body does, right? When it fights disease, it builds antibody against that. So next time when you actually get especially if it beats the disease, then you build antibody. So next time when the disease entered the body, because the antibody is there, the body can fight it. So what I'm trying to say is, if the dog is already, if you're treating a pet for a disease, it's not advisable to give a vaccination, because the pet is not at its best at that time. You're running the risk that the dog might get a disease, even if it's not a full-blown disease, but it can get even how can I say it, a low-grade disease that might turn up later and end up affecting the dog. So the advice would be, if you're treating the dog for something, unless I don't know what circumstance I would, for example, give a vaccine. The only one maybe would be like the rabies, because the rabies is really just a piece of the virus that they give, but I still wouldn't give it. I would always wait, because rabies is such a deadly disease that if we run in the risk of the dog getting the disease, then it's bad. But with rabies vaccine, you can never actually get the disease, because it's such deadly disease that they don't want to risk it. So maybe that one. I still wouldn't do it. But if you're gonna give, maybe that one. But I still wouldn't do it, because the pet doesn't need another thing to try to protect against. Because then you overwhelm the system. Maybe even if it doesn't get the rabies, but the disease it was fighting might even become weaker. and that disease now might get even worse and maybe end up killing the dog. So therefore, I would not vaccinate the dog for with anything if they're already sick and you're treating it with something. Wait till they're healthy, because we've had situations where I had to send pets home and said, look, let's wait at least 4 or 5 days, maybe a week, then you come back, then we vaccinate.
Yeah, beautifully answered, doctor. So that's how we have to deal with immunocompromised animals. So
Yes.
yeah, we'll come to. I think this is with this question we are winding up the Q&A session. So to add on a point which you have already explained regarding our liquid paraffin, Dr. Aden has said that liquid paraffin act as laxative. Is this help cod digestive tracts to reduce absorption of toxin and move the poison faster? So he has asked it as a doubt, but it is an addition to a point which you have already explained. Yeah,
Yeah. Okay.
yeah.
Thank you.
So, so I think today's session has truly been an, extremely informative and an insightful discussion. So, providing a lot of valuable perspectives on the prevention and also the management of common health issues in companion animals. And, I'm sure the knowledge shared today will greatly benefit all the veterinary professionals and animal caregivers across the globe. So the session was too good. So I think now we'll move on to the lucky draw. We'll move on to the lucky draw. So I think now, Dr. Tommy, you can stop sharing your screen. So now we'll share
Okay.
screen and we'll be announcing the lucky draw winners.
Okay. Let me see if I can get the. Hold on.
Yeah,
Oh wait, no, I'm doing it in the wrong thingy.
yeah, done,
Okay.
done, 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 Doctor.
Share. Oh, okay. I'm done. Hey,
Yes,
wait,
yes.
is it done already?
Yeah, it's
Wait,
it's
hold
done
on.
from your side. We are running the lucky draw now. We'll be spinning
Okay.
the lucky wheel spin.
Thank you.
So yeah, and now we are sharing our screen. So first we'll be announcing the third prize winner. So once we do the lucky draw, we'll select the winner and our concerned VSMs in that country specific region will be contacting the winner and the prize and award will be given to the winner. So we'll start spinning for the third prize. Yeah, the most awaited lucky draw winner. Yeah, congratulations, Nogsi Asinga. So, yeah, he has been awarded the third prize. I think he's a friend of Dr. Tommy, I guess. Yeah, Doctor, your
It's,
mic
it's
is.
actually my wife. She was listening
Oh,
in.
okay, okay, okay. Okay, fine, fine.
It's so cool. She
Yeah,
won.
so so it's great that she has attended the webinar and also she got prize in this. So congratulations, both Dr. Tommy and your wife. So now we'll move on to the second prize winner. Yeah, congratulations, Mr. Komen Mbale. So Komen Mbale has been awarded the second prize. So congratulations for securing the second prize. So your concerned VSMs in our country of your specific country will be contacting you and you'll be awarded with the prize. So once we finish with this webinar, concerned country people will be contacting you. Yeah. Now we move on to the most awaited first prize of this companion animal international webinar. Yeah. So yes, congratulations, Emmanuel Abono Yen. So you have been awarded the first prize. I think Emmanuel is also a friend of Dr. Tommy. I'm not sure. Dr. Tommy is smiling.
This one I happen not to know, but I'm so happy for everybody that they got to win
Okay, okay.
something. Thank you guys so much. You made this so great experience, and for me, I'm quite happy for everybody.
Yeah, okay. Congratulations, Mr. Emmanuel. So for securing the first prize, so our concerned country heads will be country team will be contacting you. Our sales managers, service managers will be contacting all the winners. So I think that is end of the webinar. So the lucky draw winners has also been awarded. So everybody will be receiving the webinar presentations. People in countries where we have our ALS cares applications, you can download the webinar presentations from the knowledge center of our ALS cares app, where we'll be giving the push notifications for once we upload that in the applications. And remaining countries will be sharing the presentation through email. Yeah. So I think we'll move on to the vote of thanks. So, ladies and gentlemen, as we come to the end of today's insightful webinar on, care of your companion animals, both prevention and management of common issues, it is my great pleasure to deliver the vote of thanks. First and foremost, I would like to express our deepest gratitude to our distinguished keynote speaker, Dr. Tommy Asinga, for sharing his invaluable knowledge, vast clinical experience, and practical insights with us today. So, Dr. Asinga, your journey from Suriname to the United States and eventually to Zambia, along with your decades of dedications to veterinary practice, truly reflects a remarkable professional life committed to the welfare of animals. So, your expertise in companion animal practice, particularly your surgical experience and all the clinical experience, your tremendous that has provided a tremendous learning for all of us. So, thank you once again, Doctor, for taking the time to share your expertise with our global audience today. Yeah. And also to all the veterinarians, students, and animal health professionals who joined us from different parts of the world today. Thank you for taking the time to participate in today's session. Your enthusiasm and for learning and commitment to companion animal health are what makes the initiatives like this truly meaningful. So, before we conclude, I would like to remind all the participants that e-certificates of participation will be shared with all the attendees. And I think we hope today's session has provided you with valuable insights that will support your work in improving the animal health and well-being of companion animals. So, on behalf of Ashish Life Science Private Limited, thank you all once again for joining us today. So, stay safe, stay healthy, and also continue making difference in the lives of animals. So, have a wonderful day, everybody. Thank you. Thank you very much. Thank you very much. Thank you, doctor. Bye bye.
Oh, thank you. Thank you, guys. I
Yes.
really
Bye.
appreciate it. It was nice.
Yes.
Thanks.
Yeah.
Mhm.
Bye, doctor.
Okay. Bye. Let me.